Running MAT clinic software across separate platforms means jumping between detox, outpatient, and program management all day, and the documentation slows your whole team down. When MAT, sober living, DUI, and supervised visitation each live in a different system, staff spend the day jumping all over the place instead of running the program. Here is how a rural MAT operator unified their software and documentation workflows onto one platform, and what it took to get licensed. We cover the unified platform, the AI-powered documentation features, bed management, and the licensing work behind opening a new MAT facility. A real MAT operator rarely runs just one service line. Native Solutions runs a level 3.5 detox program, outpatient treatment, MAT services, sober living, supervised visitation, and DUI programs. Native Solutions opened a level 3.5 detox program, outpatient treatment, and MAT services for 20,000 rural residents across 2 counties. On top of treatment, they manage supervised visitation, DUI programs, and wraparound services like parenting classes and food resourcing. Before a unified system, the operator was jumping between platforms for every program, and licensing alone meant a 213-page application that came back with 16 deficiencies. A certified grant writer spent months on a 213-page licensing application, only to have it returned with 16 deficiencies, requiring a complete revision. Documentation without good tooling meant sitting for hours flipping through books, wondering what got missed. Time that comes straight out of running the program. Behave Health's unified system is designed to consolidate supervised visitation, DUI programs, sober living, and treatment services onto one platform, so staff stop jumping between tools. The operator described having everything on one system, supervised visitation, DUI program management, and sober living management, as huge, because they were no longer jumping all over the place. AI-powered documentation features are designed to reduce administrative burden, so staff are not sitting for hours flipping through books to check what they missed. 4 pieces of the workflow decide whether a multi-program MAT clinic runs smoothly or drowns in tools and paperwork. Let us walk through each. Consolidating programs, easing documentation, managing beds, and training staff. The 4 workflow pieces behind this MAT launch. First, stop running each program in its own system. The unified EMR consolidated supervised visitation, DUI programs, and treatment services, so the operator was no longer jumping between separate platforms. Having everything built into one system meant the operator was not jumping all over the place, freeing time for program development. Second, let AI features carry the documentation busy work. The operator said being able to use the AI features to assist writing things out was huge. No longer sitting for hours flipping through books. AI-powered documentation features are designed to reduce administrative burden so staff can focus on program work rather than paperwork. Third, track capacity with built-in bed management. Bed management capabilities are designed to support treatment facility operations, part of the technology integration behind the launch. Tracking beds inside the same platform keeps facility capacity tied to the rest of the operator's program data. Fourth, get the team proficient with one-on-one training. One-on-one training sessions build staff confidence and competency on the new platform during the launch. Former sober living residents became certified PACE managers and program facilitators as the team built proficiency. The single platform managed the operator's full mix of programs at once, rather than splitting them across separate tools. Supervised visitation and DUI program management both ran inside the one system the operator described. Sober living environment management was consolidated into the same platform alongside the treatment services. Treatment services were managed together with the support programs, so the operator was not jumping between platforms. With consulting, compliance work, and a unified platform, the operator moved from a stalled application to a licensed integrated facility. Behave Health Consulting revised the entire application to address all 16 initial deficiencies and developed a multi-county licensing strategy. The licensed facility brought level 3.5 detox, outpatient, and MAT services together, with integrated sober living across 2 counties. Behave Health is designed to keep a multi-program MAT clinic's documentation and operations in one place, so staff are not jumping between separate systems. The platform is designed to consolidate supervised visitation, DUI programs, sober living, and treatment services so operators run them in one place. AI-powered documentation features are designed to reduce the administrative burden of writing notes and checking what was missed. Bed management capabilities are designed to support treatment facility operations alongside the rest of the operator's program data. Stop jumping between separate systems to run your MAC clinic. Book a 20-minute demo at behavehealth.com. See the unified platform, AI documentation and bed management built for MAT operators at behavehealth.com.